Why are anti-rejection medications crucial for kidney transplant success? Imagine giving someone a gift that can change their life, but only if it stays safe and protected. That gift is a new kidney, and anti-rejection medications are like the shield that keeps it safe from the body's natural defenses. When a new kidney is transplanted, the immune system sees it as foreign and tries to attack it. Without medications to suppress this response, the body would reject the organ very quickly, often within days or weeks. This rejection can cause irreversible damage to the kidney, making the transplant unsuccessful and forcing the patient back onto dialysis. Anti-rejection medications are designed to prevent this from happening. They work by calming down the immune system so it doesn't attack the new kidney. There are different types of rejection, like hyperacute rejection, which happens almost immediately if the immune system recognizes the kidney as a threat. Then there is acute rejection, which can occur in the weeks or months after the transplant, and chronic rejection, which develops gradually over years. By using these medications, doctors can stop or slow down these processes, helping the kidney to function well for many years. Modern anti-rejection drugs have made a huge difference. In the past, many transplants failed because the immune system would reject the organ quickly. Now, with effective medication regimens, most patients keep their transplanted kidney for many years. This success is thanks to a combination of drugs that target different parts of the immune response. For example, calcineurin inhibitors like tacrolimus and cyclosporine prevent T cells from activating, while drugs like mycophenolate stop lymphocytes from multiplying. Sometimes, newer drugs like belatacept are used to block specific pathways in the immune system. Doctors usually give these medications in 3 phases. First, during the initial period right after the transplant, they use induction therapy with powerful drugs like monoclonal antibodies to give a strong start. Then, patients continue with maintenance therapy, which is taken long-term to keep the immune system in check. If rejection occurs, additional treatments are used to manage it. Taking anti-rejection medications as prescribed is vital. If patients stop or forget doses, the risk of rejection increases significantly. Rejection not only damages the kidney but can also lead to the development of anti-HLA antibodies, making future transplants more difficult. When a kidney fails, patients often have to return to dialysis, which can be harder on their health and quality of life. Of course, these medications are not without risks. They can make patients more vulnerable to infections, cause high blood pressure, or increase the risk of certain cancers. Some drugs may also have side effects like anemia, swelling, or kidney toxicity. That's why careful management by healthcare teams is essential. After the first few months, doctors often lower the doses to reduce long-term side effects while still protecting the kidney. Recent research shows that managing these medications well can also improve outcomes for patients with other health issues, like diabetes. For example, some studies have found that certain diabetes medications can lower the risk of organ failure and death in transplant patients. This highlights how important comprehensive care is for long-term success. For anyone living with a transplanted kidney, understanding the importance of anti-rejection medications helps emphasize why sticking to the prescribed plan is so crucial. These drugs are the key to keeping the new kidney healthy and functioning, giving patients the chance to enjoy many years of improved quality of life. Always remember, working closely with your healthcare team and following their advice ensures the best possible outcome and helps protect your precious new organ.